my name is Vicki. I'm going to be your nurse for the day. Can you state your name and your date of birth?
Emily Prestwood, November 3rd of 94.
Okay. What we're going to do is a physical assessment, and as we go, I'll explain to you what we're doing.
Okay.
All right. We're going to start with your skin. Do you have any bumps, bruises, or lesions that you're aware of?
No.
Okay. Next, we're going to go to your nails. I'm checking your capillary refill to be sure that you have good blood flow.
Okay.
And your skin turgor to make sure you're not dehydrated. Okay. Now, squeeze my hands. We're going to check your grip. All right, great. And next is going to be your radial pulse, your brachial pulse, and your temporal pulses. All right, now we're going to look at your hair. Do you have any issues with your hair?
No.
Any lesions? No lesions?
No.
Okay. Now we're going to look at your head and just to see if it's equal on both sides, which it is. And now your carotid artery. Okay, next is your thyroid. So just tilt your head back and swallow for me. Okay, now come forward slightly and tilt to the right. And as I palpate, tell me if you feel any tenderness or pain. And to the left. Okay, next we're going to do your lymph nodes, so just tell me if you have any discomfort.
Okay.
First is your pre-auricular, your post-auricular, your occipital, your submental, your submandibular, your jugular digastric, your superficial cervical, your deep cervical chain, your posterior cervical, and your supraclavicle. Did you have any pain?
No.
All right. Next, we're going to do your cranial nerves. The first one we're going to do is called the olfactory, which is the first cranial nerve. So just close your eyes for me and tell me what you smell.
Chocolate.
Okay? Next, we're going to do cranial nerve number 5, which is your trigeminal. And I just need you to clench your teeth back and forth. All right. I'm going to push on your chin and your jaw should not separate. Okay, great. Next, we're going to check cranial nerve number 7, which is the facial nerve.
Okay.
I need you to smile, frown, and puff your cheeks. All right. And lastly, we're going to check the cranial nerve number 11, and that's called your spinal accessory. So just tilt your neck back all the way and forward to the sides. Try to touch your ear to your shoulders, both sides. Okay? And go in a circle. All right, and now just shrug your shoulders a couple times for me. Okay, great. That completes our physical assessment for the day. All right, so for this patient, I would note that her skin is dry and intact. There's no lesions noted. Her skin turgor is less than 3 seconds. Her capillary fill is also less than 3 seconds. Her nails are clean, round, with no ridges. Her pulses, her brachial, radial, and temporal are all equal and thready. Her carotid pulse is equal and bounding. Her grip is strong. Her hair is equally distributed. There's no lesions noted to her scalp. Her head is symmetrical. Her thyroid was palpable with no tenderness noted. Her lymph nodes were also palpable with no tenderness noted or pain or discomfort. And her cranial nerves were all intact. Thank you.